As part of the rules of previously published legal notice, notice of review and opportunity for public hearing and written comment, and public hearing and opportunity for written comment have been submitted to the court reporter and will be included in today's record. In order to ensure that the state board's public hearings protect the privacy and maintain the confidentiality of an individual's health information, covered entities as defined by the Health Insurance Portability and Accountability Act of 1996, such as hospital providers, health plans, healthcare clearinghouses, submitting oral or written testimony that disclose protected health information of individuals shall have a valid written authorization from that individual. The authorization shall allow the covered entity to share the individual's protected health information at this hearing. If you haven't signed in, see Courtney. Those of you who have prepared text of your testimony, please note that you may submit the written text, which will be entered into today's record and made available to state board members prior to the October 22nd meeting. The script says, I ask that you please limit your comments to 3 minutes, but there aren't that many of you there, so if you go over, I will time you, but I'm not going to cut you off at 3 minutes and 30 seconds. Prior to beginning your remarks, please provide me with your sign-in sheet, which is the pink sheet, and then please clearly state and spell your name for the court reporter, and then you can give your written comments to me after you're done. Are there any questions? No. Hearing none, today's proceedings will begin with a representative from West Suburban Medical Center. Thank you. Number 1.
Good afternoon. First name is Joseph. Last name is Catalino. O-T-T-O-L-I-N-O. Good afternoon, members of the board and fellow citizens. Thank you for this opportunity to testify for this application before you. I'm Joseph Catalino, Chief Executive Officer of West Suburban Medical Center in Oak Park. We serve not only the west suburbs, but the neighborhoods on the west side of Chicago, including the Austin, Humboldt Park, Garfield Park, and Lawndale. Our patient profile in 2017 shows that 72% of our patients were Black and 9% of our patients were Latino. We also are on the front line with our partners PCC, Community Wellness Center, combating the opioid epidemic. On October 1st, the state of Illinois designated us as a safety net hospital, confirming that we played an important role in providing the health care to some of the regions most in need. We urge you to support our application before the board that will fully and structurally bring West Suburban Medical Center under the pipeline healthcare system. This will allow us to be the benefit of the scale better serve our community with high quality, cost-effective health care and for decades to come, just like we have for the last 105 years. It is clear now that the new model of healthcare delivery are necessary to achieve this goal, especially in impoverished and urban communities. Freestanding hospitals are no longer economically viable or suitable for long-term care. Since we face many of the same challenges that pipeline other hospitals have faced in Dallas and Los Angeles, we can use their knowledge, experience, and best practice to better serve our patients. To give you a small example, West Suburban is in need of a new electronic medical records. But by being part of the larger system, we can share on the low cost with other hospitals in our network. And as part of the larger healthcare system, we have better financial stability and can attract and retain medical talent. The change request in our application, while it may appear small, is critical for West Suburban's long-term future and the health of our communities. Our hospital, like many others, continue to navigate a healthcare system undergoing dramatic changes brought by the passage of the Affordable Care Act, changed by the state of Illinois with its Medicaid managed care, and more. We need to continue to adopt and have the ability to build a 21st century healthcare system for Chicago, the region, and Illinois. Your support with this application will help us to just do that. Thank you.
Thank you. Number 2.
Ade Kunle Onyemi. So the first name is Ade Kunle, and the last name is Onayemi. Good afternoon, members of the board and fellow citizens. Thank you for the opportunity to provide public comment today about West Suburban's application to be part of the Pipeline Health System. My name is Ade Onyemi, and I serve as the chairperson of the West Suburban Medical Center. I've been on this board for 8 years. Perhaps more importantly, I've also been a patient at the hospital and experienced the high quality care that its physicians, nurses, and staff provide to this community every day. They're some of the most incredible, dedicated healthcare givers that I've run into. I've lived in other countries, so I'd like to think I have a proper perspective of what they bring to the community. So I come to you as the chair of the board, a patient of the hospital, and a long-standing member of this community. Since 1984, Oak Park and the nearby neighborhoods have been home. I've dedicated my energy to improving and caring for this community by holding public office as far back as 1997, serving several organizations in the Austin neighborhood, and now in my role as chairperson of the West Suburban Board. My primary concern has been the health and welfare of residents of this community where I live and work. These experiences have provided me with firsthand and in-depth knowledge of the health challenges residents face. They have also underscored how the work that West Suburban does is so essential and why we need this hospital for many years to come. I'm also proud that we train new physicians who can and do see the genuine challenges people face. My work is to see that we are part of a supportive and collaborative system. Approving the application before you will help achieve this, as it is the understanding of the Board of Directors that Pipeline is committed to serving this community that is so dear to us. Pipeline has other hospitals in Los Angeles and Dallas that serve many people of color and individuals with little means. Being part of a more extensive health system that has deep experience in serving these populations is critical. I want West Suburban to remain a good, healthy, and sustainable institution that provides high quality, cost-effective care for the citizens of Chicago, Oak Park, and the other communities around us. I appreciate the fact that we care for a very diverse population, and we can meet people where they are, whatever their needs. In other words, West Suburban Medical Center is the fabric of the community itself, and we must keep it strong. I thank you again for this opportunity.
Thank you. Number 3.
afternoon. My name is Kenneth Troy Cook, K-O-C-H. I am a citizen of Oak Park. I've been here for 9 years, and I live on the 200 block of North Taylor, which directly abuts the emergency department right behind my house, West Suburban. I've had the opportunity to both use the services of West Suburban for the physicians that use the offices there, most notably Dr. Romano, orthopedics, who I think has treated both of my children multiple times, as well as the emergency department a couple of times for my family. So I have both an experience with West Sub, but also as a neighbor with West Sub, and I appreciate the security that runs through our alley probably once an hour. Full disclosure, I am a pharmacist. Work for a drug company. I've also worked in managed care, so I am in the system and I understand both the changes in the healthcare infrastructure that are needed, both the laws as well as many of the pressures that are out there today. So I do understand the need for a freestanding hospital to find a larger group. I also understand the physicians that need to find a home in this new value-based payment system that is out there. I come to you with some concerns. Two. Number one, I understand that the Westlake Hospital that was recently closed entered into an agreement with Pipeline Healthcare. And that there were promises that were made to the community, and I've spoken to the mayor of that area, happened casually. And I understand that the timeline for that closure happened more rapidly than I think it was originally promised. I've also had experience with a family member seeking psychiatric care, and the psychiatric beds that were at that Westlake Hospital were sorely needed in this area. And unfortunately, that family member had to go all the way down to Ingalls, the University of Chicago property, which is extremely well run, but happens to be an hour away. My concerns that I'd like to address, number one, I understand the need to centralize and to work with a large organization. The economies of scale to meet some of the requirements are necessary. But West Sub is an integral part of this community. I see it both the symbiotic relationship with Austin and Oak Park, as well as those individuals here in Oak Park. I would like to express two things. One, that any changes that are made need to be done so to ensure the ongoing survivability and ongoing presence of West Suburban Hospital here in Oak Park. Anything less than that, I think, would be a derelict of duty for both our community as well as not appropriate to move. The second is that I'd like to communicate my need for, if there is a need for additional dollars put into West Sub. It is a facility that, as I walk through, needs some upkeep. But the physicians, the nurses, the staff that are there that I've interacted with are top-notch, and I believe if they're given the resources that are required, you can be seen as a shining star here in Oak Park like other organizations. I appreciate the opportunity to speak and the opportunity to learn more about this as it moves forward. Thank you.
Thank you. Number 4. Thank you.
Hi, good afternoon, everyone. My name is Sylvia. Last name Saenz, S-A-E-N-Z. I am one of the first of what was supposed to be 7 people that were laid off from Westlake Hospital. And I worked there for 23 years. I worked there in surgery, scheduling department. I worked in the emergency department, and I worked in same-day surgery. I witnessed firsthand what the community is suffering. You know, the opioid crisis, healthcare changing. You know, there's so much in the community that is needed. And not just for our community, but the communities that surround us as well. And we do understand that there's changes in the healthcare system, but when Pipeline took over, they began with lies. And all of those lies have just had a huge domino effect on even what's gonna happen to West Suburban. Let me begin by saying, I have been a witness at all the court proceedings, all the lies that Pipeline has submitted, okay? They said they were gonna keep us. They sold us. I mean, you know, they pretty much filed bankruptcy. That was against the orders that we had, a restraining order for them to comply. The judge already agreed with that. Furthermore, of course, we're still going to court for that. And as you may understand, they did somehow submit for bankruptcy. As they submitted for bankruptcy, we discovered upon going to court that they have created these ghost company names. Those ghost company names have no assets connected with them, no financial institution. So what is the purpose in them trying to change the name of West Suburban? There has been layoffs at West Suburban. Unfortunately, we've all heard about it. I'm trying to encourage these people to come and be the voice to be heard, because they're about to go through the same situation that I and my other co-workers suffered as well. Pipeline was very irresponsible for not having a backup plan. If you decided to sell us, file bankruptcy, you should have done the right decision. You should have had a backup plan. There's a lot of people that are suffering on the streets because of this. And we understand healthcare is gonna change, but you should have had a backup plan. And this is the whole purpose in me coming forward to speak on behalf of West Suburban, because they're gonna be blindsided just as well. And all the beautiful things that you've said, Mr. CEO, Mr. Chairman here, you've said all these beautiful, colorful things about West Suburban, and that is not the truth. You paint this picture, but behind it, there's a different facade that will be exposed. And who here even understands what's even gonna happen? That's the sad part. And we need to stick together and fight this battle, because unfortunately, when and if West Suburban does get shut down, what is going to happen to that majority of patients that come through that direction? Have you thought of that? Do you have a backup plan? Do you have an urgent care facility in the works? That should have been thought of instead of making this irresponsible decisions, creating these ghost companies. You know, that's something that I think you as an adult, Mr. CEO, as a human being, should be discussing that on the table with your Pipeline board of directors, the people that have the money. I mean, you bought it for a reason. Why did Pipeline even buy Westlake, West Suburban, and Weiss? I'm just really devastated at what the future is going to hold for everyone. And I invited plenty of people that still so far are not here, and I would appreciate those medical staff personnel to have a voice. And I guess I'm the voice right now for all of those that are running late because they're taking care of their patients that they still have. Because we do have a lot of patients that still come to us, whether it's in this community or the Melrose community or the communities in the surrounding areas. There's a lot of sick people out there, and the fact that this is not going to go away, the only problem right now that I see is for how long? How long are you going to string this out and lie to the people? I'm not even sure what else to say, because I know West Suburban has a lot of good-hearted people there. I know the type of patients that go there as well. I was a patient for many years. I too went to see Dr. Romano there. I too had surgery with Dr. Romano. I value and respect all of these medical personnel. And I just think that it's all very irresponsible and not to be able to come here and speak the truth and speak about what's really going to happen. The unspoken. That's the sad truth. The things that we don't know that are about to happen. That's the sad reality. That's why I called West Suburban last night and urged them to come. They have no idea what this hearing was about. I know what it's about. It's about the lies.
Thank you.
Thank you.
We don't have a number 5. We're gonna, is there anyone else in the room who hasn't signed in yet who would like to speak? Okay. We will still be here for a while to see if other people show up. If any of you are, I'm gonna just give you a little bit of information. If you are not gonna stick around with us, you're more than welcome to, but people are busy. What you need to know is our board meeting where this project will be considered is on October 22nd, and it's at Bolingbrook Golf Club in Bolingbrook. The State Board staff report on this application will be posted on our website, and that actually might be up already. It's supposed to be posted today. And if you would like to make written comments about the State Board staff report, those have to be received by U.S. Postal Service or other mail carrier no later than 9 a.m. on Tuesday, October 14. And if you do want to send written responses to the board, you send it to the board. You look at our website, you'll see where to send it. That's easiest. I don't want to read the whole.
Could you just give your website?
www.hf as in Frank, S as in Sam, RB as in Health Facilities and Services Review Board.gov.
Thank you.
So